Good Wednesday afternoon. I'm Charity Menifee, Director of Communicable and Environmental Disease and Emergency Preparedness here at Knox County Health Department. Our moment of gratitude today is dedicated to families with school-aged children. We know these past couple of weeks have not been easy as you've had to navigate what is best for your family. These days, there are no easy decisions, and we want you to know that we are very grateful for you and that we are right there with you making these same tough decisions for our families. As a reminder, the Board of Health meets tonight via Zoom at 5 p.m. The public may watch the meeting live on Knox County's YouTube channel or the Knox County website. The meeting will also be televised live on community television. Regarding testing, as we mentioned last week, in an effort to reduce the amount of time folks are waiting in line in the heat, we have been looking at other spaces for COVID testing. That said, we are planning on conducting testing at an alternate location beginning next month. In the meantime, Knox County Health Department will continue testing at the main health department location, which is 140 Dameron Avenue, Monday, Wednesday, and Friday from 8 a.m. to 12 p.m. in order to avoid the afternoon heat. Once the schedule and location regarding the new testing space is confirmed, we will make a public notification. Now we'll move into the local situation. We have 2,515 confirmed cases of COVID-19 in Knox County. Additionally, we have 117 probable cases. 1,102 of our cases have recovered, giving us 1,392 active cases. 171 individuals have been hospitalized at some point in their illness, and 38 Knox County residents are currently hospitalized. We are saddened to report that we have had an additional death due to complications from COVID-19, bringing our total to 21. Our thoughts and prayers go out to the family and friends of these individuals. Now we'll transition to the benchmarks. As a reminder, for the majority of our benchmarks, what we want to see is no 3-day statistically significant shifts within a 2-week time period. Every day, we look back at the previous 2 weeks. That's what a rolling average is. Overall, what we mean by this is we are trying to see, are things getting better, staying the same, or getting worse? And if so, how much better or worse, and at what rate? We will now pull up the data. And as a reminder, all of this data we are going to talk about is on our website. You can find it at covid.knoxcountytn.gov/case-count. Moving to the first benchmark, sustained reduction or stability in new cases for 14 days. To illustrate this benchmark, we have a bar graph that shows previous cases, new cases, and the growth rate over time. We have seen consecutive days of red flags and a significant continuous increase in new cases. This causes us to represent this traffic light as red. This is a concerning trend and one that is causing us to approach a new normal for new cases. But these large day-to-day increases is not a normal that we want to see. It further reiterates that this virus is still very present in Knox County and is increasing at a high rate. This continues to reinforce the critical importance of the 5 core actions. Our second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. For this benchmark, we are utilizing 2 bar graphs, one that shows a sample of tests conducted for Knox County residents and another for the average time between specimen collection and lab report data. The number of tests conducted continues to trend up, which is what we want to see, and the lag time has gone down, also a good thing. As a point of clarification, we have talked several times about lab delays that we are experiencing here at KCHD, with results sometimes taking anywhere from 10 to 12 days to come back. However, there are enough tests that are being done in our community with a quick turnaround time that contribute to the lower community average that you see on our website. As a reminder, based on the sample of tests that we can see, We at KCHD are only conducting about 16% of the tests conducted for Knox County residents. However, because of all the data during this time period may not have been reported yet, due to some of these lab delay challenges, we are still representing this benchmark as yellow. As we mentioned last week, we are in the process of nailing down agreements with other labs in an effort to diversify our lab partners, which should cut down on the lag time here at Knox County Health Department. Our third benchmark, sustained or increased public health capability. For this benchmark, we aim to reach out to cases within 24 hours and close contacts within 48 hours. To date, throughout this pandemic, we have accomplished this for all of our cases and contacts. Because of that, this benchmark continues to be represented as green. It is important to note, with the volume of active cases increasing, this goal is getting harder to reach. We have staff beginning to come to work or beginning at home from work at 5 a.m. a lot of days. They're working 7 days a week to reach out to cases and contacts. We continue to build out our contact tracing capacity to be able to respond to the growing caseload. You'll notice our team grew by 26 people from this time last week. That comes as a result of cross-training more of our team members so they are well equipped to jump into the EPI support team as needed. Additionally, as we mentioned last week, a new contract with Tennessee Department of Health will allow us to further expand our contact tracing services. We hope to have more information on that soon. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. These graphs show the availability of regional hospital beds, ICU beds, and ventilators from our hospital partners. It also shows the additional surge capacity for these categories, as well as the COVID positive patients and the patients with pending test results in the hospital. These data are gathered from the information hospitals put into the Tennessee Healthcare Resource Tracking System, or HERTS. It may reflect Knox County, East Region, or patients from other jurisdictions. For this benchmark, the traffic light is yellow. We did experience days of statistically significant increases regarding positive patients, ICU patients, and ventilated patients. After speaking with our hospital partners, they stated the benchmark should be represented as yellow. As the hospital systems continue to meet at least weekly, assessing the situation and planning the response together. As always, decisions regarding how to classify this benchmark as green, yellow, or red are made in concert with our hospital partners, as well as taking all of the data into consideration. And our fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. As we mentioned last week, we have been working on a new way to represent this benchmark. Moving forward, we will use a graph that shows the reported deaths of Knox County residents by date. This benchmark is represented as red because we have seen statistically significant increases in deaths. 55% of Knox County deaths were reported in the last 14 days. And I'll now open it up for questions.
All right, as a reminder, go ahead and type your questions in the chat feature. All right, the first question we have is from Brian Hornback. He says, can you explain again briefly the active cases, probable cases, and recovered case numbers, and how sometimes those numbers do not always appear as people expect them to? The example from a reader, he says, is the number of confirmed cases is 2,515. The number of recovered cases is 1,102. And the number of active cases reported is 1,392. But the math doesn't seem to add up. Active 2,515, recovered 1,102 should equal 1,413, but KCHD has it as 1,392.
Can I get back to you on that? Because that's a lot of math there, Brian. In general, there may be some, I'm trying to think through how that works out. It could be a simple error that we need to fix on the website, and we'll double check that. But there can be probable cases in there as well that affect the numbers. The deaths can affect the numbers as well. But we'll reach out to that. We have that question documented, right? So we can look at it and make sure that we're good. But in general, active cases are either confirmed cases, so that's a PCR positive test result. And then we also have our probable cases that are counted in there and do reflect in a lot of our numbers, which are either an epi-linked case. So meaning they're a contact to a case that have developed symptoms. Or we also have added with Tennessee Department of Health, if you are clinically ill with symptoms and you have a positive antibody test, that can be considered a probable case as well. So there's some of that in there. And then recovered is when folks roll off of our monitoring period, which is at this point 10 days from their onset of symptoms or their test result, and then 24 hours fever-free and improvement in symptoms. Both of those things have to apply to roll off. I hope that answers it, but we'll look at the math on that, make sure we don't have an error as well.
And Brian, from looking at your question, I believe what you need to do is you need to subtract the active from the total, including the deaths as well, and then you'll get the number.
Thank you. Thank you. It's hard when you can't see it,
can't
all
read
those
it,
numbers.
All right, from Paul with WBIR, we've seen case counts steadily rise in the 37920 zip code, and early on those numbers were small. It now has the second highest number on the heat map. Do you have any thoughts on why numbers are now so high in the South Knoxville, Knox County area?
I don't have any specific information. There's definitely community spread happening, and I think we're going to see fluctuations in zip codes around the county. And that's really to reiterate, when we start seeing these things rise across the board, we're seeing a lot of, in talking to cases, of hearing about people that were not feeling well, didn't feel right, and still went to a baby shower or went to work feeling unwell. And so there's lots of those types of things that are happening that can continue to contribute to the spread of disease that we're seeing. So we really want to, and we say this every time, go back to those 5 core actions for everybody, no matter where you live, whether you're in a currently zip code that seems to have more cases than others. We want everybody to do those 5 things. So making sure that you're social distancing, you're keeping that 6 feet between people, wearing a mask. And it's not just, if you have people that don't live in your household and you're having a party at your house and it's going to be really hard probably to keep 6 feet of distance. You want to be making sure that you're wearing that mask as well. Washing your hands frequently, cleaning and frequently disinfecting surfaces, and not going out if you don't feel well. Even if you're waiting on test results, we really want you to stay home and make sure that you know that the mask does not substitute that distance piece. Oh, and staying home when you're sick. That's the other piece there.
Paul's follow-up question is also, what value do you place on having the zip code map? What are the merits?
Honestly, that was, I believe, a request from you all in the media to have that. And so it kind of does give an idea if we were seeing cases. That's based on residents of cases. But we truly want everybody to know that there is COVID throughout this community. And so we want to make sure that people are focusing on the fact that no matter where you go, there's potential risk, and that you all need to be following the core actions to prevent the spread of the disease.
From Megan with WBLT, what is the cause of the delay in returns on test results?
We've talked about this a lot. There's a lot of questions or a lot of potential reasons on that. You might want to reach out to some of the labs, but I think it's laboratory processing capacity. There's a lot of increased volume in testing that's happening, and only so many tests that can be run at different labs at a time. There has been some issues still off and on with actual having the supplies to run the labs, to run the test at the labs. Those are probably the main 2 issues, would be volume and supplies.
Also from Megan with WVLT, she says, this is coming from a viewer. Is the health department considering stopping medical professionals from performing elective procedures? That's
a decision that would be made from the governor's office. We don't have the authority to make those recommendations for our medical partners according to his executive orders.
Also from Megan with WVLT, did the federal officials who are now recommending a statewide mask mandate for Tennessee meet with KCHD officials? And if so, what was the nature of the meeting?
Can they clarify which federal officials they're talking about?
Yeah, Megan, if you can clarify your question, we'll get back to you there. From Paul with WBIR, what are some areas or communities that KCHD has targeted for testing recently?
We were at Greater Warner last week. So in East Knoxville, adding testing there. And then we've done some specific testing for clusters as well that have been identified. And again, we, as you know, don't go into details about those, but specific cluster targeted testing.
From Vincent with the Sentinel, the school district's deadline for parents to choose whether their children will attend school physically or virtually is tonight at midnight. What information can the health department provide to parents who are unsure of what to do?
You know, we understand that it is a very, very challenging and difficult decision for these families to make, but we want to encourage people and empower people to look at the data that's out there, talk to your schools, talk to your medical providers, and make the best decision for your families. I think it's a good thing that there is a choice so that you can make what you feel is the best choice and do what you feel is right. And we want to encourage people to do that. There's not a right or wrong answer there. And, you know, if you have questions, definitely talk to your provider if you're concerned about your health, if you're working in the schools, or your child's health, if they have some pre-existing conditions, they might be able to help.
Also from Vincent with the Sentinel, the district has outlined metrics for how it will determine what color schools are operating on, and includes student attendance rate, teacher staff attendance rate, substitute fill rate, and guidance from the county health department. Since the majority of these metrics will not be available before school starts, what data is KCHD providing to KCS to make their decision?
We're talking routinely with them. We have at least a weekly setup call, talk typically more than that. And we're going to be looking at and talking with them through what our benchmarks are and looking at the data that's out there for the community. That's the perspective that we provide to them. And then they utilize their internal metrics as well. But it'll be mostly revolved around our benchmarks at the time.
This follow-up question is, KCHD and KCS said it will continue to monitor multiple metrics, including health data. What specific health data are the two of you using to make decisions?
Yeah, I think I just answered.
His next question is, counties adjacent to Knox County are using specific measures of active cases in the county to decide what kind of instruction will occur. Mm-hmm. Was KCHD aware of that framework for school reopening?
Well, I think you guys brought it to our attention earlier this week or maybe. So we've talked about it with them, and we are looking at the metrics that we're providing to them with the benchmarks, and we'll be talking through that. But we did talk with them about that this week.
From Paul with WBIR, he's got a question on the testing benchmark. KCHD and others still see long delays for test results. Mm-hmm. Rapid tests are less accurate, but still counted as a part of the average. Mm-hmm. Do you think 15-minute tests, which yield higher numbers of false negatives, skew the KCHD average? Does it not send the wrong message for the benchmark to be listed as less than 4 days when more accurate tests sometimes take 10? Well,
the point of that, though, is we still, it's a challenging thing. Let me say that as well. It's very complicated, but we act on the positive cases no matter what on there, and it does still indicate testing that's available within the community, which is what that's looking to do. And we do also know that there are providers that are getting rapid turnaround time for traditional PCR tests as well that contribute to that delayed number. So some of our providers, some of our hospitals, they're not seeing all of them aren't seeing the 11 to 12 day that we're running into right now with the lab provider we've talked about. So there's a lot of variation in there. It's not just, I used that as an example last week, but it's not just that. Like I said, our test is about 16%. There's a lot of variation in what that is.
From Jeff with WATE, can you tell us about the outreach to the Kirundi and Spanish-speaking communities mentioned in the CRAFT team report, and what resources did you receive along those lines from federal authorities?
Yeah, so on that note, we actually brought up those concerns with the CRAFT team when they came, knowing our data and knowing our populations and where our concerns were. We brought up those two concerns to them, knowing the challenges that come with that, with the cultural challenges and language barriers. And so outreach things we've done, we've already talked a lot about on the Hispanic side, but we've done a lot of video promotions and working with leaders in that community to help put out messages in ways that they have told us that the community would receive them best. And that's what we're working on doing for that community. We've also done testing events and things of that nature, gotten masks into the community as best we can. Again, working with groups that are working with the Latino community. And we're doing the same thing with our refugee community. So with the folks that speak Kirundi and other people from the refugee community that we're seeing cases in, we were asking for resources for languages and for cultural information from the feds, and they have provided us some of those as well. And then we're taking the same approach with that population and getting trusted people from the community and leaders within their community here to also help us with messaging and some videos and to circulate the messages, as well as getting masks out into the community and some testing events as well.
From Vincent with the Sentinel, for several days you have not been conducting testing due to heat issues and lab delays persisting. Why is the testing benchmark listed as yellow and not red? By your own criteria, reduced testing delays, it would seem to have not improved from last week.
So I'm going to go back to our testing is about 16% of the testing in the community. So we are looking at all the testing that we're able to see, which is a sample, and that number continues to trend up. It was a little bit lower, but the trend is still moving up. And so that's why we made it a yellow. Yeah, and we also just missed testing on Monday. That's the only day we didn't do testing.
From Megan with WVLT, a WVLT viewer would like to know details about exactly how COVID-19 is determined as the cause of death for those who are included in the Knox County's death count.
If the medical provider reports them as a COVID-19 death to us or the medical examiner's office, we count them. So their determinations are made from the medical clinician side or from the medical examiner's office is how we report those.
From Jeff with WATE regarding the Kraft report, mentioned some items like celebrity outreach. Has there been any progress on that front?
We've had discussions and are working on it. I don't have anything that we can announce right now, but we are looking into doing more of that.
From Paul with WBIR, is there a representative there today from the hospitals that could answer some hospital-specific questions?
They are not here today, so you'd have to reach out to them directly.
From Megan with WVLT, she says this comes from a WVLT viewer. When will the pandemic be over?
Oh, I wish I knew that. It's just impossible to tell. I think that following those 5 core actions that we talk about is what will help us flatten the curve and get to a place where and buy more time to get a vaccine and treatment in place. But a lot of that's going to depend on what the community's response is and how well we're able to mitigate things that are happening. And then when we do get a vaccine and effective treatment for this virus, but we don't know.
From Claire with WUOT, can you give an update on the $7.1 million state grant announced a couple weeks ago? What is the timeline for receiving these funds?
It's been through county commission at this point and been approved. It hasn't. Oh, it's on next week. Sorry. So it was on for review, and then next week will be approved voting. Sorry, for county commission. I'm getting help here. Sorry. And then from there, it'll go back to the state. We'll get final signatures at the state level, and then from there, funds will get allocated to us.
Also from Claire with WOT, how do you find translators for minority language populations? Do you hire translators locally for contact tracing efforts?
Depends on which ones. So we have brought in some contract bilingual folks that speak Spanish to help out. And then for other languages that we don't have translators either on staff or that we can contract with, we use our language lines or the Foreign Language Academy. I believe that's the appropriate name.
Also from Claire with WUOT, are there now or will there be, after you receive state funding, grant opportunities for local nonprofits who aid in KCHD's education or translation efforts?
This funding pretty much will go directly towards contact tracing efforts and testing efforts in our internal response at this time. There's, testing is very expensive and all the things that go along with that. And there are state and federal guidelines that go along with that and that we have to follow.
From Vincent with the Sentinel, is KCHD going to present the leaked White House documents outlining recommendations for red zone and yellow zone states to the Board of Health along with the benchmarks?
Okay, we did send that report along with the Kraft report that we received to the Board of Health.
From Megan with WVLT, to her previous question, she said the officials she was referencing are representatives from the Centers for Disease Control and Prevention, the Federal Emergency Management Agency, and the U.S. Department of Health and Human Services.
Okay, so that was the Kraft visit team, I'm assuming that she means. And what was the original question? I'm sorry.
Scrolling back up to the original question.
I believe it was about mask mandate. Sorry.
That's okay. Curlin. Her original question was, did those federal officials who are now recommending a statewide mask mandate for Tennessee meet with KCHD officials? And if so, what was the nature of the meeting?
Oh, so yeah, that was the craft team that came that we've been referencing when people are asking about the report. So it was a person from CDC, a person from ASPR, which is the Assistant Secretary of Preparedness and Responses Office for the Department of Health and Human Services. That one's a mouthful. And FEMA. The three of them came here and met with KCHD leadership and city and county leadership and the hospital leadership and some others. And that's where the mask mandate had already occurred at that point. So I'm a little confused about the rest of the question.
About how that team was involved in the White House report.
Oh yeah, oh yeah, thank you. Somebody's trying to help link the dots that I'm missing. So how that affects the White House report that has also, they just referenced that came out. We don't really know how that process works on the federal side.
All right, I see we have 3 more questions in the chat feature right now, and these are the only 3 questions we'll be able to get to. So let's go through those. From David with WVLT, Knox County Board of Health voted to issue an order requiring people to wear face coverings in virtually all indoor public spaces on July 3rd. We've had an increase in cases ever since. Are wearing masks giving people a false sense of security?
Well, I don't think so. I think that they really have been proven to be effective in helping to limit the transmission of this disease. But also it's going to take some time to see the effects of that. We've been saying that. This would probably be the earliest we would start seeing any impact from the mask ordinance. And that's still honestly being very generous. When you think about cases that were already out there and people that have been exposed and all of the contacts that folks have, it's going to take some time to see an impact. And we hope that we do see that soon. But this is a pretty short time frame still.
From Brian Hornback, the joint statement from KCS and KCHD, he's asking who has the ultimate authority on distancing of students and staff in Knox County schools next year? And can parents be assured that the students will be 6 feet away from one another, or if their children come in contact with a child or staff that is COVID positive?
So the first thing is the schools and the superintendent and the Board of Education have the authority for what happens with the schools. And so given that, those questions should be directed to the schools.
The last question we're able to take today is from Paul at WBIR. He asks, the CDC report says a statewide mask mandate is needed. Do you agree, especially with people traveling in and out of Knox County from areas where mask use is not mandated?
Well, I mean, I think our message from the beginning has been that mask use and all of the 5 core actions are very, very important. And so we encourage those to be out there as much as possible to encourage people to use them. And so it's up to the governor's office whether that becomes a statewide mandate or not. But we do very much endorse and support people wearing masks when in public or around other people. Even if you're having a dinner party at your house and people are coming in and you can't stay 6 feet apart, you need to wear the mask.
Okay, and my apologies, I accidentally skipped over one question. Claire, because we got a couple minutes, Claire with WUOT, and your outreach work with local leaders and refugee communities to create informational videos and distribute masks. Do you compensate these leaders and nonprofits for their work, or is it all volunteer? It's
been all volunteer at this point. Oh, it's both? Oh, okay. There's been some, so we'll have to follow up with that. I don't know the answer, how we've done that.
All right, looks like that's all the questions, everybody. Thank you all for your time, and we will be back with you on Friday. Have a good rest of your day.